All right, we're going to shift gears a little bit here, like Randy said. So radon is a leading cause of lung cancer in smokers and non-smokers, and is also linked to blood cancers. Lung cancer in Utah is actually the leading cause of cancer mortality, and there are currently no screenings for lung cancer in non-smokers. This means that preventing exposure to inhalable carcinogens is really the primary method of prevention for reducing the burden of lung cancer in non-smoking populations. Because there's no screenings, lung cancers are often diagnosed at very late stage, meaning survival of the disease is very low. Because of that, the ribbon for lung cancer actually used to be clear because it's the invisible cancer, as our survivors really aren't there to tell their stories. And now it's just white, which disappears against a physician's white coat. Okay. Okay. Okay, so radon is a naturally occurring carcinogen that arises from the decay of uranium. In states like Utah, with natural deposits of uranium in the soil, up to 1 in 3 homes have been reported to test at unhealthy levels. So currently, radon is measured in indoor air and is considered unhealthy if it's greater than 4 picocuries per liter. The number sounds very small, but 4 picocuries per liter is actually the equivalent of getting 200 x-rays to the chest a year or smoking 8 cigarettes a day for an entire lifetime. So radon testing in Utah is not required anywhere and is thus very low. Only 17% of Utahns have ever tested their home for radon according to self-report. And of those that tested, only 8% remember having radon greater than 4. So this is very different from the state release statistic of 30% of homes testing greater than 4. And so since testing is not required by any state laws, radon testing in Utah is largely encouraged through a statewide educational program run out of DPQ. And while this program is statewide, there are still gaps in who reports getting their home tested in survey, as well as like who really should be getting their home tested. So this information is critical as public health programs often run on lean budgets, as you at DEQ probably know. And so creating interventions that are targeted to specific populations to encourage testing in those groups at highest risk may be better at encouraging testing in those vulnerable populations than state programs that just indiscriminately target everyone. So this movement towards population-specific interventions is called precision public health. So just to put it in a different way, if precision medicine is about delivering the right treatment to the right person at the right time, precision public health can be viewed as delivering the right intervention to the right population in the right place at the right time. In order to do this, we need the data that can help us target these populations efficiently. So in the context of radon, what data are currently available to identify populations at risk? So the answer is too much and not enough at the same time. And so these are 3 different maps showing 3 different ways to estimate population level risk for radon at the county level. And as you can see, all of these maps have semi-conflicting information. The EPA map on the left shows county level estimated risk for radon exposure in the home, and the rural counties are mostly red, meaning that they're at the highest risk, while most of the urban Utah counties appear to be at moderate risk according to EPA. And this map has been used by multiple epidemiologic studies and also public health agencies to create radon education programs. So the map in the middle is from the CDC, and this map is derived from laboratory tests collected from radon educational programs across the nation. And this is just a map showing the median county level radon that's been collected in laboratory tests. As you can see, these results are very different from what the EPA map is saying. Basically, all of urban Utah is at risk, and most of the northern counties are at risk for radon exposure greater than 4 picocuries. Now, the map on the right, bear with me, shows the radon potential emission soils in Utah, with those soils at the highest, with the highest radon emission potential shown in bright red. And as you can see here, there are ribbons of high radon potential soils streaked all across the state. So what do we make of all of this, conflicting information? Which map is actually the best one to use to create interventions? So there's no studies in Utah or even national studies showing if maps of radon soil emission potential are correlated with household tests, which could be incredibly useful. We can figure this out on small geographic levels, so it enable specific public health targeting of specific populations. So in comes my study. So we sought to determine if we could use small scale measures of radon soil emission potential as a way to estimate risk for radon exposure in homes in lieu of the county level maps provided by EPA and CDC. This will remove reliance on the county level data provided by those agencies, which is really not helpful sometimes because counties in Utah can be incredibly large and very sparsely populated. So to do so, we accessed a database of radon tests collected through a statewide educational program from 2001 through 2017. And we geocoded the location of each of these residential radon tests to their radon soil potential. And we sought to determine if these test results from these individual home tests were correlated with, number one, radon soil emission potential at the residence. Number two, the census block group radon soil emission potential. And number three, EPA's county level risk classification system. So in bullet point 2, we chose census block groups as our ideal unit of intervention. As number one, they're small enough to represent pockets of populations, and they're quite stable as census units are considered pretty stable over time relative to areas like zip codes, which can fluctuate over time and change in their boundaries. So what did we find? Okay, so this table describes the maximum radon results from homes in Utah classified by their radon soil potential and the EPA classification. So we found that the percent of homes that tested greater than 4 picocuries was greater than previously thought. It's actually closer to 40% of homes in Utah than 30%. And homes in Utah also have the potential for extremely high levels of radon. Here we found a max of 170 picocuries. When we examined patterns in the radon tests according to the soil potential, we found that a greater percent of homes on high radon potential soils had radon tests greater than 4. In contrast, the EPA classification basically didn't provide any of that same degree of information. So this regression model uses the home test as the outcome, regressed against the residential radon soil emission potential, the block group percent of residences on high radon emission soil potential, and the EPA county classification. And what we see here again is that having your home located on high radon soils is predictive of having a radon test greater than 4. Being located in a block group with anything greater than 0% of high radon emission potential soils is also correlated with a high risk for unhealthy levels of radon in the home. And again, we see here that the EPA county classification really is not reflective of home radon results at all. So since this data set was derived from a statewide educational program, we wanted to understand if there were gaps in participation in this program. So we identified block groups with less than 5 homes in the data set and we considered those as low participation block groups. And in general, the low participation groups had a fewer percent of homes on high radon emission soils, which is good news. And they also tended to be located in rural counties than the groups we considered adequate participation. However, the low participation block groups also had a higher percent of Hispanics and Native Americans than block groups that we considered adequate participation. So what this is showing is that there's this racial and ethnic gap in our understanding and awareness of radon exposure in racial and ethnic minorities in Utah. Okay, so what did we learn? We learned that radon soil emission potential can be used as a way to estimate a home's risk for having unhealthy levels of radon. This is helpful for public health interventions as the geologic soil maps showing radon emission potential are readily available. It can also be broken down by neighborhood. So this image here shows the radon emission potential for the Provo-Orem area. So if you live here, you can try to find your house on this map. The areas in dark gray are the areas with the high radon soil emission potential. The light gray is low to moderate, and the blank or the white is low. Please keep in mind that even moderate homes located in moderate areas can still test greater than 4 picocuries. So we also found that the prevalence of having high radon in Utah homes is greater than thought. It's really closer to 40% than the 30% that's previously estimated. And these numbers are actually wildly higher than what's reported by the public at 8%. So this is showing that there's a huge gap in what the data is saying and public perception of their risk for being exposed to this carcinogen. And again, we found a major gap in participation of the radon testing program by racial and ethnic composition. So overall, I believe these findings illustrate the need for a widespread system for indoor radon surveillance, both in Utah and nationally. However, this can be hindered by the current legal framework surrounding radon testing. So these are just a brief list of the policies that other states in the US have implemented to encourage radon testing. So some states encourage testing for radon during real estate transactions. Other states encourage it testing and also mitigation in public and private homes. Utah has none of that legislation. The only legislation we have is regarding the certification of radon mitigators. And so because of that, it's a bit difficult to actually enforce testing in public and private spaces. So what can we do about this problem? Well, I'm speaking with a bunch of very smart atmospheric scientists. And so EPA does have stationary monitors in urban areas to detect radon, but these stationary monitors don't do a great job of picking up radon in rural counties, which we know are also at risk. In addition, the current standard for radon tests are these charcoal tests that you leave out for 3 days. What we found in our data set is that these tests are prone to user error, and some people leave them out for too long or not long enough, or they just never mail them in. And so can we borrow practices from community-based data collection like Purple Air? Or is there a way to facilitate the combined data from private radon mitigators who routinely test houses, like multiple houses a day? Is there a way to facilitate them to contribute data in order to create a better surveillance system in our state? And so I thank and acknowledge the many contributors to this work, and I thank you for your time. And I'm ready to take questions.
Any questions? There's one right there.
Do we have any data on how effective the mitigation is?
So we have a limited number of post-mitigation tests in our data set, but again, that is limited because there's no regulation that says you have to test after mitigation systems put in, and that's in any buildings in Utah. And so the post-mitigation tests that we have seen actually do work. They do appear to lower the radon. But again, that's only of people who opted in to test their home after mitigation system was installed.
Any
Okay,
other questions?
there's one right here.
Oh,
Yes.
So when I've dealt with people with about this before, there seems to be some confusion over whether or not you can be subject to radon because it's in the ground that you build your house on, or is it in the fill that they bring in and put under your house during construction? And does one eliminate the need, or are they both still susceptible?
Yeah, they're both susceptible. So anytime you build a home whose foundation may sit upon uranium-enriched soils, you run the risk of having radiation come into your home. And I should also add that here in Utah, we also have the added risk of having radon in drinking water. And that is becoming more of an issue with our drought. It's basically putting pressure on wells and sucking up more of the radioactive material into drinking water. I know, isn't this great? I hope you guys will go home and just go home and talk about how wonderful life is. Okay, anyone else? If there's no questions, I'm happy to send the microphone over to the next speaker.